Namaste. This is Dr. Shwetha by Baratike. Uterine lining, else we call it as endometrium. So endometrium is nothing but the inner line of the uterus. This is where all the important processes happen, where the implantation happens. Endometrium is a very important part which plays during implantation. Is there an ideal thickness of the endometrium? Yes, there is. An ideal endometrium would be anywhere above 8 mm. The appearance should be a triple line or a 5-line endometrial layer with good vascularity. What I mean by vascularity is good blood supply to the endometrium. So when we have all these criteria in place, definitely the receptivity of the endometrium increases, thereby increasing the chances of pregnancy. What happens if the endometrium is thin? You or I will not know, when I physically look at a person. So how do we know this? So whenever there is a scanty period, what do you mean by scanty period? When they don't have any flow, like a drop of the period or 2 drops of period, and then it just stops completely. So this is when you have to go and evaluate and ask your doctor why the period flow is scanty. When we do a scan during a mid-cycle, we have to see a nice layer of the endometrium. If there is thin endometrium, what I mean by thin endometrium is less than 7 mm, it could be 4 mm endometrium or 5 mm. So in this kind of scenario, the embryos will not get implanted, thereby decreasing the chances of pregnancy. Now, how do we improve the endometrial thickness? First and foremost should be the physical activity. So whenever there is physical activity, it increases the blood supply, thereby increasing the blood supply to the uterus. It will help in increase of the endometrial thickness. Suppose even while hormonal tablets, after giving hormonal tablets, if the endometrium is not increased, then we add on injections to see if the endometrium is going to improve or not. With all this, if endometrium fails to improve, there is a new therapy which we call it as PRP. This is a plasma rich platelet therapy. Here we take the patient's plasma and then inject into the subendometrial area, so thereby increasing the chances of good endometrium. So there are various ways to improve the thickness of the endometrium. So only when the endometrium is of the optimal size, we will have a good pregnancy.